Awesome. Hi, everyone. Thank you so much for being here today. Um, Before I pass the mic to my colleague, Sarita, I just wanted to touch on a few housekeeping elements for all of us today. As we share the resources, all the links for these resources will be shared in the chat, and they'll be sent along in an email as well after the webinar. We also have time for Q&A at the end of this session, but please go ahead and drop any questions or comments that you have in the chat, and we can make sure to gather those and answer them at the end of the session. And today our goal is really to just share a wealth of resources that we hope will be useful to you and your organizations moving forward. And we want to acknowledge upfront that there will be a lot of information shared in a very short amount of time. So we invite you to use today's session to identify the resources that you may want to return to or explore at a later time. And with that, I'll pass it to my colleague, Sarita.
Thanks so much, Riddhi. So my name is Sarita Wilkins. I'm the communications strategist with the National Resource Center for Refugees, Immigrants, and Migrants, or NRC-RIM. Just want to thank you for joining us today. I'm joined here with my colleagues Claudia and Riddhi from Ideoorg, and we're excited to share our newest project that we're calling Mothers for Mothers. Next slide. So first, I'm going to give you a quick overview of NRC-RIM, and then I'm going to showcase some of the resources that we have that support vaccine confidence among mothers. And then Riddhi and Claudia will show you how you can plan and implement a health-focused meetup group for mothers from RIM communities. And at the end, we'll introduce Makespace, which is a tool for public health professionals and community organizations to create their own customized vaccine campaigns in partnership with local leaders. So NRC-RIM we're funded by the CDC and housed at the University of Minnesota. And we exist to support health departments and community organizations working with refugee, immigrant, and migrant communities that have been disproportionately affected by COVID-19. So we do this by strengthening partnerships between health departments and communities and by supporting the organizations that work in RIM communities directly. So we support organizations by collecting and disseminating best practices. We create health communications and health education, and we offer online training. We also have technical assistance and a few other services. Now we have a lot of COVID-19 health communications materials available today, but I'm going to specifically focus on what we have for mothers. Now, we heard that from our partners that fertility was a top concern among people in RIM communities. So we created this fact sheet. It's translated in more than 40 languages, and that really incorporates perspectives that are common in many immigrant communities. For example, we say that the vaccine will help you stay healthy and strong so that you can continue to provide for your family. It also notes that vaccines protect parents, vaccinated parents protect their children, both by preventing the children from being infected with COVID-19, but also because, for example, antibodies can be passed on to babies through breast milk. Now, we really tried to highlight why vaccines are important at every stage in a relationship. So for people concerned about fertility, we show a young couple who may be considering having children someday. And then we show that it's safe for people while they're pregnant and again after they give birth. So it's safe while breastfeeding and also for people who may want to have more children. And finally, we show that vaccines are safe for older children as well. And so with this photo, we show multiple generations, and which is something that we heard was of particular importance to many folks in immigrant communities. We also have a fact sheet on vaccines for children. So this is also translated in more than 40 languages and also includes key messages that are relevant in immigrant communities. So it shows that vaccines are how children can stay safest, and vaccinated children protect the greater community. So to continue with this theme of protecting the greater community, we actually just released an animated short called Children Keep Our Community Strong, which highlights the perspective of one immigrant mother as she explains why she chose to vaccinate her 2 children against COVID-19. The mother talks about people in the community who need protection, like elderly relatives and classmates and others. And she also talks about protecting community assets like schools and businesses. So this video touches on themes like preserving their way of life, protecting future generations, and ensuring children can carry on family traditions. And this is available in 14 languages total. And while developing Mothers for Mothers, we learned that many mothers are really concerned about vaccine side effects for both themselves and their children. And in many small communities, one person's negative experience with the vaccine side effects can dissuade others from seeking out the vaccine for themselves. So as part of the Get the Facts campaign, we have social media assets in more than 40 languages that address a number of issues, including details about side effects. These facts also address other issues that are of concern to mothers, like about fertility, about vaccines during pregnancy, and about vaccinating their children. So we have a number of other resources that support vaccine confidence in immigrant communities more generally, not just among mothers. We have a section of our website called Vaccine Central, which has resources to support vaccine planning, rollout knowledge and confidence among refugees, immigrants, and migrants. And so this includes checklists and guides, as well as promising practices from around the country that you can replicate in your communities. And we know that dispelling myths and alleviating apprehensions around vaccines requires a trusted relationship and a non-judgmental environment for people to voice their concerns and ask questions. So we created these conversation guides to help equip your staff with the skills to answer questions about COVID-19 vaccines and participate in these conversations with others. And so we create these guides as new issues emerge and frame them around immigrant and refugee experiences. We also have 3 campaigns. The first one you see on the left is from our Get Vaccinated campaign, and this is based on feedback we've gotten that indicates that people from many different backgrounds connect with the theme of protecting their communities. The middle is a sample from the Get the Facts campaign, which is based on CDC guidance, offering facts about COVID-19 vaccines in a simple and memorable way that counters common misconceptions. Now, these 2 campaigns are translated and customizable with drag and drop templates. So if you want to remove our logo or change the URL or use a more culturally affirming photo, we have templates available for you to do that. And then finally, on the right is a sample from the Vaccination Is campaign, which was created using a community-led hyper-local communication strategy that honors the priorities and the values and the expertise of community leaders. I'm not going to get into that right now because Rudy and Claudia will talk more about that in just a moment. But the Get Vaccinated and Get the Facts campaigns are effective if you want to broadcast messaging that's universal at a large scale. But for a more targeted campaign, it's important to partner with the communities themselves to learn what will work best. And with these tools, you can easily conduct your mass communications campaign for a broader community, as well as develop targeted messaging for those who are hardest to reach. And we believe that both of these approaches are important for any vaccine campaign strategy. And with that, I will hand it back over to Riddhi.
Thanks, Sarita. We'll now just share a few more resources that the Ideoorg team and NRC-RIM teams have created in collaboration with community partners. And just to touch briefly on who we are at Ideo.org, we are a nonprofit design studio, and our mission is to work alongside communities to design towards a more just and inclusive world. And we use an approach called human-centered design, which simply means that we center people who will benefit from and use these solutions as the key decision makers and influencers. And so community-driven work is something very likely familiar to you all in this group here today. Human-centered and community-led design means that people who this work will impact have the power not just to input on the work, but ultimately are the drivers, influencers, and decision makers. So from surfacing the challenges and needs that communities are facing, to co-creating along design teams as equals, to offering ideas and feedback and testing concepts in their communities, to leading on decision making around what we're designing, and finally co-creating strategies for rollout and implementation. And we believe that when it comes to sharing information, who is sharing the message is just as critical as what the message is. And so our work seeks to engage community leaders who have already built trust in the community to serve as these messengers. And just to add a bit more color of what we mean by working alongside communities, we use methods such as role plays, where community members hear about how folks are already talking about the vaccine, collaging and filling the blank exercises to explore slogans that might resonate or sound appealing, inviting folks to react to messages and outreach efforts that already exist to get a pulse on how people feel about what is already out there in the world, and sessions that invite community leaders to share feedback on early ideas and concepts. But much of our work as a design team is really just around creating the conditions for community leaders to bring their full selves to the table and to be compensated fairly for taking the time and space to share feedback, reflections, and co-design with us. So our overall goal is to increase vaccine confidence and improve vaccine uptake in refugee, immigrant, and migrant communities. And we do this by creating easily customizable and accessible toolkits, ranging from communications to increasing awareness and confidence in the vaccine, to services that you might actually use to get people vaccinated. So today we will share a couple of tools that we've created, and you might use each of these based on the portion of community that you might be trying to reach. So if you're trying to increase vaccine uptake among mothers from refugee, immigrant, and migrant communities, you might use the Mothers for Mothers tool. If you're trying to build confidence in your community broadly, you might use the Vaccination Is and Makespace tools. And if you're trying to reach young people in your community, you might use the No Judgment tools, which will be available in a few weeks. So now we'll share a bit more about each of these. And I'll pass it to Claudia.
Hi, everyone. My name is Claudia, and I'm a program lead at Ideoorg. Together with Riddhi, I help to manage and oversee all of our projects that relate to vaccine hesitancy, but also I was one of the core design team members that build Mothers for Mothers. So I'm very excited to share this work with you today. Mothers for Mothers is a toolkit built for any community-based organization that wants to reach refugee, immigrant, and migrant moms around the vaccine. At its core, what it is, it's a peer meetup, so an opportunity for mothers and parents to gather and to connect. If we go to the next slide, yes, we can see that at its core, Mothers to Mothers is a meetup. So really any opportunity for like-minded people to gather. Essentially, it's a time for mothers to take a break from the labor of caregiving. It also represents a time for mothers to connect. In the research that informed this project, we learned about how isolating the experience of migrating can be. And so this is an opportunity for people with similar lived experiences to gather. And most importantly, it is a moment for mothers to receive reliable information around a health topic. This program was really designed to be long lasting, but of course the first gathering is designed to be around the vaccine. The reason, or part of the reasoning that inspired this work, really is the reasoning that if we can reach mothers, mothers often have the decisions that they make impact other members in their household. Additionally, at the time that this was developed, there was new guidance coming out around vaccination of young children. So we realized that there was an opportunity here for great impact. Additionally, this project came about in partnership with Refugee Women's Network. Refugee Women's Network is a community-based organization based out of Atlanta that serves refugee women. We partnered with them to develop this program, and in addition to that, they helped us recruit 4 community co-designers. The community co-designers are women from the Eritrean and Somali communities in Clarkston who were with us at every step of the way. So our community co-designers were responsible for helping ensure that we were centering the needs of their communities, but also in addition to helping us surface needs, they were helping us to test out prototypes in their communities and gather feedback from their communities on what was working and not working. If we go to the next slide, I just want to share 3 of the central insights from our research that informed the design of Mothers for Mothers. And first and foremost, we really heard that mothers want help navigating unknowns. They don't want to be told what to do. And so Mothers for Mothers is designed to be an opportunity for participants to receive reliable health information, but it's designed so that it doesn't feel at any moment like people are being pressured, bribed to make a decision that they're not comfortable with. In addition to that, we heard, and Sarita touched on the fact that who you spend time with determines whether you have the vaccine. And a lot of these communities' surrogacy reviews, whether positive or negative, can have a long-lasting impact. And so we've designed Mothers for Mothers so that one of the core activities is really a time for people to hear from other people in their community who've received the vaccine and have had a positive experience. A lot of times what we've seen in running these gatherings is that people just oftentimes they need a little nudge or a push. They need to have their concerns heard and addressed in order to make a decision. And then lastly, a third thing that really informed our design of Mothers for Mothers is the fact that for a lot of these communities, vaccination may or may not have been a common behavior in a previous home country. And so while nationally, a lot of the media effort has been around advocating for the COVID-19 vaccines, at times it's really necessary to take a step back and advocate for vaccines in general, explain the reasoning behind vaccines in general. So without further ado, let's kind of get into what we actually built for Mothers for Mothers. And what we built was essentially a set of tools so that any organization, really any group of people that wants to host a meetup can do so. And we've created tools that make it easier to plan, to invite people from the community, to figure out what activities to host during a meetup. We've organized all of these tools around 4 key moments. First, we've created tools that help you plan. Here you'll find considerations around logistics, around finding a venue, time. You'll even find a tool here that can help you plan out a budget and help you identify how much money you might need to set aside in order to host a meetup. Then we've created tools that help you promote Mothers for Mothers meetups within your community. So here you'll find customizable invitations that you can build in 10 minutes or less. So in 10 minutes or less, you can have an invitation that's ready to be shared with your community, either digitally or in print, so that you can promote this gathering. Third, we've created tools that help you prepare. So essentially, once you have a date and time, a venue, once you have people joining, there's obviously the question of, well, what actually happens during a meetup? Under prepare, you'll find an example agenda, you'll find a set of activities, as well as descriptions, all the way down to scripts of what you can actually say during the meetup that of course we invite you to customize and to make your own. And lastly, we've made tools that help you present. So during a Mothers for Mothers meetups, here you'll find a set of slides that you can project or that you can print out and share with the community, as well as considerations for follow-up after the meetup, how you can follow up and ensure that action gets taken. So I'll go ahead and share my screen to walk us through some of these tools and share how you can actually use them to plan and to host a Mothers for Mothers meetup. So one of my colleagues can share in the chat the link to this website, but essentially all of the Mothers for Mothers tools live here. And you'll see that we've organized them by the 4 moments that I was just laying out. Let's go into plan. Under plan, what you'll find are a lot of checklists and considerations to keep in mind as you're starting to organize a meetup. We've identified key roles, and there's not necessarily 4 different people that have to fill each of these roles. It can all be done by one person, but essentially we've organized the website and the tools for the person and for the role that should be using them. So everything on this page is really meant for the person who's owning and managing the logistics. Another thing to note about the site is that all of these sections are collapsible and expandable. So say if you want to learn more about safety, something that's obviously really important if there might be unvaccinated people present, here are some of the things we suggest that you keep in mind. Additionally, you'll find tips around technology. 2 things I want to call out that are specific from our research in hosting a Mothers for Mothers meetup. We heard that transportation and childcare was really important. So what Refugee Women's Network did in Atlanta when they host these meetups is that they help to organize either ride shares or Uber or Lyft for women to participate. And then additionally, there's accommodations for childcare and people who need childcare so that participants can be really fully present and perceive this really as a moment for a break from the labor of childcare. Lastly, you'll see these links that say download. Anytime that you click on a download link, what this takes you to is a Google document. The reason why we've used Google Suite is because they're free for anybody with an internet connection to use. And what you do what you'll see is like this little link to use the template, and then that opens up the actual document, which means that you can fully own and edit this. So in the case of this budget tool, I might say be able to go in and directly edit the number of participants and use this tool moving forward. So this is everything that you can find under plan. Let's take a look then at promote. So the promote section of the tools is really intended for the person who's the community recruiter. This is someone with ties to the community who's really responsible for broadcasting the fact that this event is happening, inviting people, and tracking their RSVPs in attendance. So the first thing that you'll find under promote are a set of text that has already been translated into a number of languages. And the idea is that you can easily copy and paste this into any messaging platform. WhatsApp, Viber, Messenger, whatever is best suited to help you invite individuals to the gathering and also know what to respond. Additionally, you'll find templates to create invitations for social media or for print. Again, you'll find a variety of translations, but I'll show you just how these work so you can see how easy it is to create an invitation in 10 minutes or less. Once I open up this document, this is the social media template. You'll see that creating an invitation really is as simple as choosing whether you want a full color invitation or a wide edge. For today, I'll just choose the full color. And then once I'm in the full color, I have instructions in the margins that help me understand how to copy and paste, fill in the blank, and customize this. So first I see an invitation to change the characters, and here you'll see a range of characters. In my case, I'm from Venezuela, so I might pick characters that closely resemble my community. I'll go ahead and add them in. And then in addition to that, you can go ahead and change the title. So you might make a new title in Spanish. You can go ahead and edit the slogan, edit the description, the time and date. You can go ahead and edit the logo as well. You can also add a sticker mark. In this case, I might choose one that really closely resembles the colors of my flag. And then once I'm ready with my invitation, it's really as simple as downloading this, and then it's ready to be sent out to the community. So that's a little bit of what you can find under plan and promote. I'll hand it over to Sarita to walk us through the remaining two sections.
Thank you so much, Claudia. Just gonna share my screen. I am having some technical difficulties. Just give me 1 second.
Now might be a good time for me to just remind folks that if you have questions or comments, feel free to drop them in the chat. And we're happy to, we have some time left over at the end so that we can make sure to address all of your questions.
I am having some technical difficulties and I'm not able to share my screen. So I'm wondering if Claudia, you would want to walk through this part for me.
Perfect.
Thank you so much.
Of course. Would you want to talk through it and then I can just click around for you?
Yeah, sure.
Perfect.
Sounds great. So right now, after you've gone through the steps that Claudia kind of spelled out, you've planned your space, you've done your transportation and childcare and budget, and you've got your invites out and you're already collecting RSVPs. So now it is time to prepare to host the meetup. And this facilitation guide breaks down every activity that you'll need to do, so you'll never have a dull moment and never be at a loss for what to say. So if you scroll to the top, Claudia, on the right side, you can see that you can download this guide as a PDF or even preview the Google Slides presentation that you'll use during the meetup by clicking those links. So if you scroll, going back to the website, just scroll down a little bit. You start out with a few tips and tricks, and then you have an agenda. So you can write down in the agenda who will be facilitating each part of the meetup and who will be taking notes. And then you have the activities. If you scroll down a little bit more, each activity in those yellow boxes at the top, you can have an overview of what the mood should be like, how long it'll take, and which slides go with each activity. So if you click on where it says corresponding slides there, slides 9 and 10, yep. And then go down, I'm gonna actually start on slide 6. Where you can kind of see where the presentation starts. And so each presentation, each slide, if you look at the speaking notes, actually has what you need to say or what you need to do. So if you don't like clicking back and forth to the website, you have everything all in one spot. So yep, then you can see the speaking notes are there. Going back to the website, you will see kind of a brief description of the activity under how it works. And you could click on the different tabs for more information. So after the introduction, there's a warm-up activity. And then there's another activity, if you keep scrolling, that outlines expectations for the meetup so that everyone will feel comfortable sharing their experiences and asking questions. In activity 4, you will introduce the health topic. In this case, it's COVID-19 vaccines. And you'll see there's an option in the slides to show an educational video. And in the tips section of the website here, you'll find tips on how to find your own video if you don't want to use the one that we queued up, or even find videos in other languages, and tips on how to create your own video if you choose to do that as part of your presentation. So the next, there'll be a brief break. And then you'll discuss the health topic in more detail. Now for this, we have what we're calling concern cards to facilitate this. If you click on the downloads tab, you'll have yep, that's fine, just like that. You'll have your concern cards. And so what these cards have is common questions about COVID-19 vaccines, as well as answers from trusted sources. And so you also have at the bottom of each card, follow-up questions, discussion questions to help you guide the conversations. And these concern cards are different from other FAQs you might have seen about the vaccine, and that they were created to address concerns that we heard from mothers specifically during our design process. And so these cards touch on subjects like citizenship status, getting the vaccine, concerns about side effects in children, whether or not health insurance is required, and things like that. And so you can use the concern cards that we made for you, or at the end of this presentation, there's a template so that you can create your own concern cards if there is a concern that's specific to your community that you would like to address. So going back to the website, you'll find that there is a brief closing activity, and then you're done. And so finally, you're ready for your big day. I'll have you go to the present section of the website. So once you're familiar with all the activities that you'll have to do, you're ready for your day. In this present section, you'll see links to download a sign-in sheet. You'll have another link to the Google Slides template with all of your speaking notes, and then links to download the concern cards. Now there's also guides on what to do after the meetup. So we have scripts for following up with people on WhatsApp. And you can also use our social media assets to follow up with people on specific topics. These are part of our Get the Facts campaign, which we have translated in more than 40 languages. And so then we have, if you scroll down a little bit more, a few videos that you can send out that have to do with vaccinating children. We know that within some communities, it's important for families to all get vaccinated together. And so this might help improve vaccine confidence for that. So that's all I have for the toolkit. Oh, I'll also, yeah, if you want to host more meetups, this is very interesting. A lot of people start with, they want to do COVID-19 vaccines. And then in these meetups, you have information, you get information from the mothers, like, I want to learn about breastfeeding, or I want to learn about child nutrition. And so people can really have, we can have another meetup group every month or every quarter about different health topics. And we have guides here for converting what we've done about COVID-19 vaccines to whatever might be of interest to your communities. So that's all I have for the toolkit. I'm going to invite Fariha from the Refugees Women's Network. She came to our first webinar, but she couldn't be here today. But we have a little recording of what she was able to share.
All right. Hi, everyone. I'm Faria from the Refugee Women's Network here in Atlanta, Georgia. I am a community health coordinator and handled primary logistics on behalf of RWN to help build Mothers to Mothers. I just wanted to hop on and share both my experience using these tools during the first prototype session, as well as translating these tools to a virtual format for the following session because of the Omicron variant temporarily suspending our in-person programs last month. So to start, we successfully launched our prototype discussion hour in December, where we had a total of 14 attendees between two community groups of Amharic speaking and Somali speaking mothers. Both sessions were held in language by two of our community health promoters, and a lot of their community recruitment was done using the invite kit tool we built together in this project. We also used a lot of signage and the big posters to highlight our event while it was happening. We then, of course, presented to the mothers and held discussion, an amazing discussion, using the concern cards afterward. We received genuine questions, genuine communication, and it was obvious that all the mothers there were so attentive and engaging and therefore comfortable. That in itself was a big success for us as a community-based organization, the fact we were able to give mothers a comfortable space to speak. At the end of the event, we sent everyone home with their incentives, some flyers, and out of our 14 participants, there were 7 vaccinated and 6 unvaccinated. And out of those 6, 4 women chose to book appointments and to get vaccinated the very next day because of how well our program worked. We had a second event a month later in January, and like I mentioned, that is when Omicron numbers were going up, and we decided to suspend a lot of in-person programming and have a lot of things be virtual. So we welcome back our mothers from the Somali community, and due to how positive of an impact our first event had on them, we had 21 people show up on our Zoom call just from that one community alone. Now, because it was on Zoom, we didn't have to worry about social distancing, making sure masks were on. So that was a big plus for virtual. Although I will say that many of our mothers prefer in person because it really brings more of a community feel when you're speaking with other women in your mother tongue in the same room. From our side, we also realized it's much easier to facilitate discussion and gather info such as individual demographics and a better follow-up process, because talking to some singular people when there's 30 people in one Zoom call is a little bit hard, right? So we adapted the RSVP list for that. But we don't want to eliminate virtual meetups entirely because that's just the reality of the situation. We may have to do things virtually in the future as well. So we adapted some tools, specifically, like I said, the RSVP, to more properly manage online participation by having pre-registration forms for demographics, as well as better tracking who actually comes to the Mothers to Mothers if it's online on Zoom, because it's just really easy to lose track of stuff if there are that many screens. Many people use different names on screen. So we just adapted tools to make these details easier to follow. Overall, we're still learning and improving every session as we go along, but I can without a doubt say that regardless of how many people we're attracting, the quality of every session has been top tier. And I'm really grateful we get to have something like this for our community, to give them this reliable, educational, safe space for them to meet with each other. And that is more than enough to have a positive impact. Thank you.
Wonderful. I'll now go back. I'm going to stop sharing really quick and go back to sharing the other screen. All right. Hopefully that was helpful to hear from Faria's perspective about what seems to work well when it comes to actually hosting a meetup. Unfortunately, she couldn't be here today, but we'll do our best. If folks have questions about how she ran the meetup and specific questions about like actually making that happen, feel free to drop those in the chat and we can do our best to share what Faria might have shared with you all. But I'll move us into our next solution. As we've mentioned earlier, the Vaccination Is campaign and Makespace. And so again, these tools are to reach your community a bit more broadly to increase awareness and confidence in the vaccine. And so we worked hand in hand with community partners to develop the foundational brand that could really unite the campaign across different communities. The messages and materials are ultimately designed to be highly customized and localized for each community in order to resonate. But when brought together, the brand elements seek to build trust, recognition, and unity across vaccine confidence efforts and different touch points. So you'll see, we'll just highlight a couple of the different brand elements that are coming together here on this screen. The slogan is a really important part of this piece. The vaccination is blank. And that blank is really encourages leaders to fill in the blank and customize these materials for what might resonate best in their communities. So some common themes that we heard are love, or the ability to protect family and friends, hope for the future, and strength and pride as a community coming together and like uniting around fighting the pandemic. There are also the images here, which are fully customizable. We have a bank of photos that are stock free and you're able to use, but you're also able to just upload your own images from folks from your own community. And finally, there's an array of colors and shapes and signals to really customize to your community. So similar to what Claudia was showing us earlier, where you can use a little Band-Aid mark, we have similar signals to help you garner trust in these images. So this is an overview of all the different types of materials that are available as part of this campaign. And each of these supports different ways to build confidence and trust in the vaccine. At the highest level are the posters and social media designed to quickly build recognition and awareness and inspire confidence in the vaccine. At the next level in form are a suite of assets such as fact sheets and longer form social media assets to give simple must-know information about the vaccine. At the third level, reassure, we have comic illustrations to storytell more complex topics that are at the root of many of the concerns that we've been hearing over the past 2 years. And lastly, are a set of materials under promote to act as sort of a champion of the vaccine yourself. So we've heard in some communities that people are really proud to show that they're vaccinated, while in other communities that may not necessarily be the case. So this fourth level of promote is certainly optional, and you should use it, based on your own intuition on if it feels appropriate for your community. And all of these materials that you see here on the screen have ready-made versions in several languages, but we also have templates so that you can quickly customize for your community. And they're built really similarly to to what you saw earlier when Claudia was sharing the Mothers for Mothers promote materials. It's really simple, drag and drop. Everything's built on Google Slides so that you can, you don't need any additional software in order to adapt the materials. So in the chat, we've shared a link where you can find the ready-made materials in several languages, but I'll now also show you the Makespace tool where you can really customize your own version of this campaign. So Makespace is designed to help you build a cohesive campaign from the beginning, and it's built to help community leaders identify your audience, identify how the community is feeling about the vaccine, determine what kind of messages would work best, and then ultimately adapt and customize the materials yourself. So I won't do a demonstration of the tools because it is quite similar to what Claudia showed us earlier, but I just want to highlight a few characteristics of the website. It's really designed for ownership. So as you navigate the website, community leaders are able to follow a simple step-by-step process with guidelines along the way, and ultimately help you create something that you can really feel ownership of. It's designed for ease. So I feel like I've said this a few times, but all the templates are built on social media, on Google Docs. So it's a simple drag and drop and fill in the blank experience. And it's really designed for inclusivity. So we've also created some activities along the journey for moments of pause, for community leaders to reflect on important questions and prompt you to ensure the materials are inclusive and accessible to the diversity of folks in your communities. And with that, I'll just share a little bit of exciting data that we've been collecting over the past couple of months. It's really been able to spread quite far, and community leaders are already using these tools to mobilize towards vaccination events that have gotten hundreds of people vaccinated, which is really exciting. And finally, the last tool we wanted to share with you all today is just a preview of the tools for increasing vaccine confidence among young people in refugee, immigrant, and migrant communities. And we've been building a set of tools that will be available in the coming weeks that are really tailored to reaching young people, spark and practice judgment-free conversations, and really creating spaces for these conversations. So I'll just say, coming soon, stay tuned. If you're subscribed to the NRC-RIM newsletters, you'll certainly be aware of when we'll host our next webinar where we can share these tools. And so, of course, we'd love to hear from you all on how you're using these tools. So we've created a quick feedback survey where you can just share any comments about using either the Mothers for Mothers tools, Vaccination is in Makespace, and any other feedback that you'd want to share with us. And with that, I think I'm passing it back to Sarita.
Yeah, thank you so much, Rudy. I also wanted to say, before we get too deep into the Q&A, we have mini grants available. If your organization wants to host a Mothers for Mothers meetup about COVID-19 vaccines and cost is a barrier to you, we do have a limited amount of funding that's available on a first come, first served basis. And so if you're interested in applying for a mini grant, I am going to put an email address in the chat. And this will also, if you don't have time to write it down right now, we'll include this information in the follow-up email that all participants will receive after this session. So now I'm happy to take questions. You can raise your hand, put it in the chat or the Q&A feature on Zoom. We did receive a question earlier today about how often are these meetups happening? Like, is this something that's happening weekly? Is it something that people are doing more or less often? And Claudia, I know that you've talked to Fariha a little bit about that. Would you take that one?
Yeah, so I think in terms of determining the right cadence of meetups, that's really depending on the organization and the bandwidth of the organization. So in the case of Refugee Women's Network, they've been having the Mothers for Mothers meetups once a month. They've been looking into having them almost bi-monthly, bi-weekly, so twice a month as well. That's about the cadence that they are able as an organization to support in terms of the planning logistics that are required to host a meetup. So it's really depending on organizational bandwidth more than something that we recommend.
Sure, that makes total sense. I know that Fariha has also held both in-person and virtual sessions. Particularly, I know when Omicron was really peaking around January, that was important to do that. How have you seen that be successful?
Yeah, I can share this again based on the information that Fariha and the feedback that Refugee Women's Network has been providing to us. It's in their case, they found that the in-person meetups have more energy and group participation. Obviously, we know the nature of a virtual event means that it's difficult, especially for them to do the individual one-on-one follow-up with participants who join the meetups, especially when it comes to supporting actual actions such as making an appointment and going to the appointment to get vaccinated. So in their case, they found that in-person meetups really serve to energize the community. Additionally, because they also serve as an opportunity for building community and for being in community. That said, with the virtual meetups, what they have found is that obviously it's a reality of the world that we live in now, that these meetups may also need to be virtual. In this case, one thing that they've flagged that they will be focusing on is obviously it's much easier to have a sign-in sheet and have everybody sign in if it's an in-person meetup. With virtual, it's important to develop a different set of tools to track who is attending, especially because sometimes people's Zoom name doesn't match their registration name, and also to be able to do that individual follow-up that they do after each meetup to make sure that they're supporting individuals who want to take action, who want to get vaccinated or get their families vaccinated, that's requires more planning virtually.
Yeah, that makes sense. I'm gonna launch a poll really quick, just post webinar survey, but I have a few more questions that have come in that I will go ahead and ask. So you had said, you know, they seem to get some pretty good participation for their first session, and I loved hearing that 6 women actually signed up to get their vaccines. So what kind of, you know, other than the invites, what about other methods to recruit folks, like incentives, for example? How have you seen that working with community organizations?
I'm happy to speak to that as well based on RWN's experience. So what they found is that they provided an incentive for participants of the first 2 or 3 meetups. And by an incentive, I mean, I think they were giving out $25 gift cards just to make sure that people were compensated for their time and to make sure that people had a draw to be able to join and participate in these events. And so there wasn't a financial incentive for participating in Mothers for Mothers. What they found was after the meetup, people were really eager and asking for the next one just because it ended up being you know, very successful moment of being in community. And so their plan is to taper those incentives off as the program grows. So essentially they recommend, and what they recommended, because this was a question that came up in a previous webinar, was to consider offering incentives for the first 1 or 2 or even 3 meetups, but then after that start tapering off those incentives and ensure that once people have that feeling of community, that's drawing them back to this gathering.
Yeah, that's really smart. And I also want to point out, you know, the difference between perhaps like an incentive and removing a barrier. Like when we talk about providing childcare, providing transportation, even providing, if you have food, like a snack break in the middle, which we kind of prompt for, that's removing barriers to participation so that mothers really can be fully present and that they're able to participate. So like I love that part of the preparation section of the toolkit, but then in addition to that, it's like, how can we add a little bit more incentive to kind of like increase perhaps excitement or attendance in the first session or the first couple sessions. It's been really great to hear Fariha talk about the excitement that's come from it. You know, people are kind of unsure at first, but once they are able to really be in community with one another as a group of mothers who have this shared experience, it's really, really sort of heartwarming. And you know, we love, like, obviously we're promoting COVID-19 education. You could do one of these meetups about what if it's not vaccines? It could be masking, it could be testing, it could be all sorts of things. Or like I said previously, it could be breastfeeding or diabetes or child nutrition. But either way, you're able to really group mothers with this common lived experience together so that they can kind of explore these common concerns together. And that's something that's really beautiful. So if there's any other questions from the audience, feel free to raise your hand or pop them in the chat. We're happy to listen to them or to address them. One thing I was thinking of that may be coming up from folks who aren't from CBOs, maybe they're from health departments or other schools, other organizations, is who's really leading this? You know, we talked about having, there's 4 roles. So one person could encompass multiple roles. They could be the recruiter, they could be the facilitator, you might have a note taker, but you know, this is a really good, and Claudia, definitely chime in, or Riddhi if you have insight, but I can imagine this is a really good role for either a community liaison, a community health worker, a family engagement coordinator, somebody like that, because somebody in that role who's actually from the community and already has that trust built with the community is going to be an expert at customizing the different templates that we put together to meet the needs of their specific communities. And if you don't have somebody like that in your organization already, really looking to community partners that you might have established who could maybe co-host this with you, who could help bring that sort of trusted messenger, trusted lens as to the presentation, the meetup itself, as well as helping plan for it. So Ruthie or Claudia, do you have anything to add to that about who is best to really run this?
I don't have anything to, sorry, Claudia. I don't have anything to add. I would just agree that I think that like trusted relationship with the community felt like the biggest piece, because I think from our experience of prototyping the session with and like building out that session with RWN, the co-designers like had like, you know, a network of people that they were like ready to invite, and it felt like, you know, they had personal relationships with people that were coming to the sessions, and so it just helps to build a sense of comfort and safety when, you know, you have an existing relationship with the liaison or the community co-designer. Go ahead, Claudia, sorry.
Thank you, Ruthie. I was just going to add that in our experience, it's not necessary for the facilitator to be a healthcare expert. And in fact, what we've seen is that it's really important for it to be a trusted peer, just as Sarita, you were mentioning, for it to be someone from the community that is trusted. And that's also why the concern cards were built, so that if you are facilitating one of these meetups and you're not yourself a healthcare expert, you don't have to be, right? There's a set of concern cards that are already written out that already reflect common questions that we heard from others as we were doing research, and that already include answers that you can refer to that do reference trusted sources. And so, yeah, if you're not yourself an expert on every single aspect of this pandemic, that should not be a reason for not hosting one of these.
Yeah, absolutely. And I imagine being a little bit vulnerable about that is also part of like building that trust, right? Like if somebody asks you a question and you don't know the answer, it's totally okay to say, I don't know, but I am going to find out and get back to you. And that's why we have some of those WhatsApp scripts, or if they use Facebook Messenger or whatever, like it's like you don't have to know everything, but we can kind of like our templates and this toolkit like kind of points you in the right direction so you can follow up with people. Having a peer, like you said, Claudia, is going to be much more important than knowing all the answers, because you're also like serving as a bridge between members in your community and these trusted sources, so you can help gather that information that does address their needs, potentially work on translations if needed, and then respond to folks about that. So I definitely agree, having a trusted peer is going to be really, really key. We just have a few minutes left, 3 minutes left in this webinar. Thank you for those of you who stuck around. Are there any questions from the audience? I saw Jennifer, thank you so much. She had a very nice message in the chat. She's a community health worker, and she does plan to share these materials with health educators, which is definitely what we want to see. I appreciate your enthusiasm. But we'll take any other questions from folks in the audience. I'm doing my best teacher pause there. They say that you have to like wait to like be comfortable in silence and let people chime in, but it's a quiet group today and that's okay. See, Emily raised her hand. Emily, how can we answer your question?
I was just going to confirm with you really quick. I know you said you will be sending all the links to the different websites and all of that in the follow-up email. There will be a recording sent to us, correct? That way we can forward that on to our colleagues.
Yep, there will be, you'll receive a recording, the slides, and all the links that we shared in the chat today.
Perfect. Thank you.
Yeah, of course. Okay, thank you for those of you who've already taken our poll. If you haven't done that, you have a couple more minutes and then we'll close out the session. We're at time. Thank you so much for joining us, and we'll follow up later on with all the resources.